ensuring sustainable financing for essential services and delivering them through the overstretched Kenya health system remains a major challenge. Achieving universal health coverage in developing countries, including Kenya, can be very challenging. This is because of the financial constraints that we face and over-reliance on direct payments at the time people need care, which prevents millions of people from receiving care when they need it. Poverty in Kenya remains one of the greatest challenges in achieving equity in health. It is estimated that about 46% of our population live below the national poverty line, of which 19% constitute the poorest segment of the population. The poor in the society continue to bear the greatest burden of the disease because they do not give healthcare priority, thus resulting in high morbidity and mortality. Kenya needs to pursue different avenues to mobilize domestic health financing. In order to realize positive results, the ongoing restructuring at NHIF must focus on freeing large amounts of funds used for administration to go towards payment of benefits, bringing more formal sector participation, redirecting resources to lower level facilities in order to provide primary care at cheaper costs, and introducing performance-based financing to reduce wastage of resources. We also recognize the need to expand the fund's coverage to other new priority areas, including non-communicable diseases. We are aware now, as you all know, that the new trend in terms of diseases is a shift from the old conventional diseases of malaria, cholera, HIV, to the NCDs, which are very expensive to treat. Every year, we have 10,000 Kenyans leaving the country. The maternal mortality rate, for example, that has dropped by 8% in the last 8 months. Now, if you convert that into numbers, previously we are losing 5,500 mothers every year as a result of pregnancy-related diseases and illnesses. So as a result of the drop in mortality by 8%, it means we are saving 500 mothers every year. Even more important, the child mortality rate in the first 9 months after the intervention has dropped by 15.3%. Previously, the statistics show that we used to lose 100,000 children every year below 5 years. Now, if you translate it into 15.3%, it means we are saving the lives of 16,000 children every year. And so it is critically important that we continue with these interventions. The target is to make sure that we reach 80% in the next 2 years for mothers going to hospitals.